Right, we'll make a start. So hello, good morning, everybody. It's fantastic to see so many people on the call this morning. My name is Matt Asbrey. I'm the head of culture, and it's my real pleasure to welcome you all here this morning, and as part of our launch of our 5 Ways to Wellbeing campaign. So I'm going to give you a little bit of a background into what the next 5 weeks entails, why we're focusing on that, and then as part of today's launch, I'm going to invite Tracey Fletcher, our Chief Executive, to talk about our theme for this week, which is about being active. So health and wellbeing is one of the core elements of our Homerton People Plan, which is our plan to make your experience, all of our staff's experience at working at the Homerton, better, and ultimately with an aim of being the best place to work in the NHS. The last 18 months have been incredibly tough, and I like the analogy, I tend to use the analogy of we've all been in the same storm, but we've all been in different boats. We've each experienced the pandemic in different ways, and we've all been impacted either directly or indirectly, and we've needed to work differently, and we need to approach our health and wellbeing differently as a result. But the reason that we're focusing on this, the reason why this is so important to all of us at the Homerton, is that we know from the research that staff who are healthy, who are engaged, deliver better care, which ultimately means that health and wellbeing is almost a quality issue, it's a safety issue. But when we think about things like mandatory training, we know that's an essentially vital part of keeping our patients safe, but we don't always think of wellbeing as being of the same importance. But actually, if people are not well, if we're not delivering the best possible care, that can become a safety issue for us. So the next 5 weeks, our 5 Ways to Wellbeing campaign we're launching today, is based on the evidence-based and well-known approach called the 5 Ways to Wellbeing, and that's about improving people's mental health and wellbeing. So each week is going to be centered on one of the 5 ways. And we're going to launch that each week with a webinar at 10 a.m. and we've got different speakers on a Monday morning. We're going to have different speakers each week to introduce the theme, and we're going to have a range of activities for people to get involved in, both socially distanced in person, online, and on social media. So lots of different things. So some of you will have seen this morning that we've got 42 teams that have entered into our STEP challenge, which is fantastic, which links really well with being active this morning. And the 5 ways to wellbeing are different ways, small incremental steps that we can each take to help with our wellbeing. The reality is that it's not going to take COVID away. It's not going to change the pressure that's there and the things that are around us. But the 5 steps are a really effective way of taking positive action that can involve small changes that change how we perceive, how we view, how we feel about that pressure, the stress, the things that are around us. So they're really small things that, whether it's going out and taking a walking meeting, making sure we take a break for lunch, that we're paying attention to things around us, all of those things can have an incremental impact on our well-being overall. A little bit later, after we talk to Tracey, I will give you an update on what to expect from the course this week, but it's a real pleasure for me to invite Tracey to speak to us for a couple of minutes. For those who may not know, Tracey is a really keen cyclist and runner, often seen arriving in the offices here after what I can't imagine going and doing a 5 or 6 mile run before work, but how you fit it in, I think, is fantastic. So I'm going to give you a little bit of time, Tracey, to talk about why keeping active is important to you and to your well-being. Over to you.
Thank you, Matt. I wasn't have quite given that introduction, but also so I was going to mention my runs and cycles in the morning, but so yeah, those who do know me probably do know that I do cycle my Brompton to and from work. It's downstairs here at St Leonard's at the moment, and there are the odd few of you who see me running to and from Victoria Park on the Tuesdays and often Thursday mornings to get a bit of a run in before work starts, and that just works with my commute. I guess, as Matt says, that or asks really, the question is how do I think that benefits me generally, me in my role, and just my ability just to keep on top of things, really. And I guess we're all different, and hence why there's 5 different weeks to put into different parts of different focus for each of the 5 weeks. But Be Active is the first week, and for me that's probably a really important issue and something I really need to do. We all have a different view of ourselves, and I guess for me, if I don't feel particularly reasonably fit or exercised, and I sort of go home and look in the mirror, etc., I just it almost affects my confidence in being able to do this job, really. If I feel like I'm reasonably on top of things, and I've done a bit of exercise, I've got the endorphins flowing a bit, and I feel like I can justify my lunch, then that works for me. Now, it doesn't work for everybody, but certainly doing some exercise and I suppose clearing my head before work through cycling or through running really does put me in a good position to be able to deal with the travails of the day. And there have been times where I haven't done anything, and I have noticed how it really does affect both my confidence and therefore my sense of my ability to do this job. Because there's one thing that you do need in doing this job is an element of confidence, not least to come into work every day. So getting on the bike to cycle me here does, even in the deepest, darkest depths of the winter, sort of blow out the cobwebs and put you in the right frame of mind to come in. I also do things at the weekend as well, and I guess that sort of sets the weekend off. You probably gathered I'm quite a morning person as well, so all of my stuff is done in the morning. But I've noticed there's a yoga and Pilates class both on Tuesday and on Wednesday this week, which everyone who runs and cycles are really generally are very bad at stretching and doing more of the core stuff. So I'm going to make myself look at those classes. I may not make them at the time, but I'll certainly look at the classes and also make sure I do a bit of stretching as well, because that's ever so good for you. So that's all I was going to say, Matt. Hopefully that's helpful.
Thanks, Tracey. If you don't mind, I'll ask you one other question. And as a runner, I've got piriformis syndrome at the moment, so I've got definitely a lack of stretching with the running that I do. But you've done this you've been in this role for a very long time, and I think you managed to almost make a routine out of your being active as part of it, and you build it into your commute. Being the chief exec, a really busy and highly pressured job. We've got a lot of staff who might find it difficult to fit things in, but you're still able to. So how do you manage that? How do you manage to prioritise that, and where do you place that amongst all the other pressures and things that fill your time as the chief exec?
So for me, it is quite a priority, really. I mean, I guess I get in early, so I make the cycling part of my commute. So I cycle from the station, and I cycle to the station at the other end. So that's always helpful. And if I got into the habit, if I didn't, for whatever reason, I didn't have the bike with me, I either run from the station or walk from the station. So even walking in the morning from Stratford International is a really good thing to do. And I guess it's just part of planning and part of routine, and having the right kit in the right place at the right time as well. That helps. So yeah, organisation, I think, and using it as part of your commute, and then on the odd day I get in early and I prioritise my first sort of 45 minutes of the day to go for a run. I'm usually done by 8 o'clock, 8:15, so I am quite an early bird.
Brilliant. Thank you so much, Tracey. I think it's really, really powerful to have you here this week in launching both the 5 ways and our being active as part of today. So thank you so much. I will just pull up the screen and I'm going to share with you our program for the next few weeks. Hopefully that will show on the screen. So as we mentioned, this is the first week of 5 weeks of, and as we said earlier, the different themes, the different a week each for each of the 5 ways. So this week is about being active, and I'll show you the timetable for this week, which is on the intranet and on the screensavers at the moment. You'll see. Next week we're is focusing on taking notice, and we've got a colleague from Talk Changes is going to launch our Take Notice Week next week in our webinar to think about mindfulness, how we consider and be aware and in the moment, and the importance of that with our well-being. So we're going to have a photography challenge starting up next week, and we're also going to have the Wellbeing Project Wingman bus on site starting from next week. I think is at St Leonard's next week, and then the week after on the Homerton site. On the week commencing the 20th is our Connect week. So we're going to have a range of different activities going on that week, including randomised coffee trials. We're going to have a social quiz night, which is being run by us. And then the 27th, we've got Keep Learning. So we've got some support from our education development and training team on that. And then the final week, the first week in October, is on helping others. So one of the things I draw your attention to is we've got our a calendar of donations. So for our food bank, local food bank. So we're going to have a number of things out each week for you to come and donate. So there are going to be donation points across the trust, including the education centre on the Homerton site and over at St Leonard's certainly. And Margaret, I'll ask to just pop into the chat where all the different sites are going to be for that. So we've got a range of things going on across the weeks. And just to give you a sense, this week of our step challenge has already started. So I've certainly got some steps in this morning, coming to the station and then walking from the station into the hospital this morning. We've got a range of things going on this week, including the fitness class tonight, a virtual fitness class at 6 o'clock. We've got yoga tomorrow, a couple of sessions of yoga. And then we've got a couple of walking groups on the Homerton site. So at 12 o'clock on Wednesday and at 1 o'clock on Friday. If you want to take some time, meet up with somebody new or different and just go for a walk, get some fresh air. This week's going to be fantastically warm. So an opportunity for you to be active and get involved. I'm going to ask, we've got the hashtag Homerton 5 Ways, which is our Twitter handle for this campaign. So we'd ask you, those of you who do tweet, to pop into Twitter any of the photos, any of the things that you're doing to be active as we go through this week. And then I've forgotten just to mention, we've got the cycle maintenance man coming on site on the 9th on Thursday. So an opportunity for a free check over, and if you need any basic maintenance from £35, he'll be on site and available to help out with that. So I'm going to stop sharing the screen there. And other than that, that's the end of the first webinar. It's fantastic to see you all. Thank you all for joining us. And we will pop this onto the intranet. And just to flag that each Monday morning for the next 5 weeks at 10 a.m. we're going to have a webinar launching the theme of each week. So it'd be fantastic for any of you who are able to make that to share with us as we go through. And we look forward to seeing and hearing all about you taking some active steps this week to look after your health and your well-being. Thank you very much, everyone. Have a great week. All the best. And just to say, well, Michelle's mentioned Better Gym are on the Homerton site today. If anyone is interested in joining, go and seeing them this week. Thanks very much, everyone.